The number of active COVID-19 cases is on the decline in Thunder Bay. As of yesterday, it was under 50 for the first time in several weeks. The surge of cases in late 2020 was fueled by at least one super spreader event and the ongoing outbreak at the Southbridge Roseview Manor long-term care home. Northwestern Ontario, like the rest of the province, has been in a lockdown since Boxing Day. The lockdown is set to end on Saturday, but the government could yet decide to prolong those restrictions. Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit, and she joins us this morning to provide an update on the COVID-19 situation in the Thunder Bay area. Dr. DeMille, good morning.
Good morning, Amy.
So how would you describe the current trend in COVID-19 cases overall in Thunder Bay?
You know what, I would say it's reassuring. It was very nice to see, as you indicated, over the last couple of weeks. We've seen definitely an improvement in our numbers, the numbers that we've had over the weeks, and we were, of course, as you remember, in November and early December, maintaining a fairly high level that was quite demanding, and we were seeing sort of ongoing spread in various different situations, and that was quite a lot of work. Mm-hmm. So it's nice to see that. It was definitely nice to see the improvement, and I hope we could keep this up. I'm feeling a little bit quite a bit nervous, actually, though, for a number of other reasons.
Well, what would be one of those reasons? What is making you nervous?
Well, what we're seeing, a couple of things, but, what we're seeing across the province, and I do carefully monitor what's happening in other areas, including in other areas of the north, and overall the provincial situation is not improving. And even though we've seen an improvement here in this health unit area, we are really the exception and not the rule across the province. And what I've seen in other health units, and in some in particular, is a very substantial increase in December and last couple of weeks of December and this first week of January. And that was sort of reminiscent to what happened to us in the beginning of November. So really the virus is still out there. I do understand sort of what's causing some of this increases in other places, and that these are all things that could happen here that we've seen before. And even in northern health units, and a couple of them have experienced a higher number of cases in recent weeks. And, that it feels very nervous that could happen here as well.
When do you expect that we'll have a sense of how holiday gatherings might impact the numbers that we're seeing here?
Really, any time. So you can, if a gathering, if somebody had spread COVID at a gathering, people might start to get symptomatic, any time in the 2 weeks following that, and then of course they get tested, and that when the positive test gets results back, then we would often hear. So it's about sort of 2 weeks after a gathering might be the time we might hear, and so we're still in that window period for sure. And we do know that gatherings did take place, unfortunately, and hopefully nobody, that was against the rules in a sense, but and hopefully there was nobody with COVID that spread it. But we also saw a drop in testing numbers in the last couple of weeks as well. So of course people need to be tested when they have symptoms. That allows us to determine where the virus is in our community and to quickly follow up on that.
I would like to turn to the outbreak at the Southbridge Roseview long-term care home. A very sad milestone this week with 20 deaths recorded. What is the status of that outbreak?
Well, the home is still in outbreak. We have regular meetings, like daily meetings, to really problem solve, to review how things are going and discuss and to follow up and to problem solve around various issues. We've consulted experts and others who have dealt with significant outbreaks just to bring that sort of knowledge into the table and make sure that collectively with Roseview, Southbridge, and ourselves and the various partners at the table that we're doing everything we can to really stop the spread of the virus in that facility. And I think in recent weeks we have seen a lower number of individuals testing positive. They're still regularly tested and regularly monitored for symptoms. But this is a really challenging outbreak. This is, it is very difficult to really bring it under control. This type of thing has happened in other long-term care homes, and it's really very impactful. Like it is maybe the worst thing we've experienced at all in this pandemic from my point of view, and hoping that these ongoing measures, the continuous improvement in policies and practices, the continuous sort of brainstorming and problem solving will bring it to an end.
What about vaccinations? So some vaccinations have begun here. What's your sense of how soon vaccinations might go to that facility?
So that's a good question. We continue, and this is really all long-term care homes, and it's sort of exciting what's happening here and what's happening across the province around the availability of vaccine, and of course Pfizer and Moderna being the next one in the pipeline that we're starting to see in the province. And we continue to have we have regular conversations with the hospital, who is of course housing the Pfizer vaccine and delivering that, and excited to hear the possibility and what's already being piloted down south in a couple of spots is being able to take Pfizer out of the hospital site and into, for example, a long-term care home and immunizing that. So that's a really exciting opportunity. Still waiting, really, and working with the government and the provincial direction on this, and the tremendous amount of work that's happening at the provincial level and applying that here. So I think there's a lot happening, and I do expect a lot to continue to happen. And while the focus is often on those health units and those areas where there's a higher case count than we have here, but really hoping we can continue to see more vaccine come in our area and being able to deliver it.
Do you have a sense of what our supply is like right now?
It's, I think, a bit tenuous. I know the hospital has been receiving some and going through it, which is, of course, what makes it more effective when it's actually given to people. So that's really great to be seen. I think that's probably the biggest question we have is exactly what is the supply of vaccine going to be for us in the future, and then being able to plan around that. And that's still a bit up in the air. And I would say overall, compared to like the health units down in the southern area, we still have a fairly limited supply. They were focusing primarily on those red and lockdown areas, and of course the First Nations strategy and the remote fly-in First Nations, so seeing some more vaccine in our area for that purpose.
The health unit has also declared outbreaks at the Thunder Bay District Jail as well as at the Correctional Centre. What concerns you most about COVID being in those facilities?
Well, I think this is an example of what I've always said, that COVID can be anywhere, and it can come out of the blue, and it can spread very quickly. And we're really feeling, I'm nervous. We're really in a very vulnerable situation right now, and this is what we've been experiencing, of course, in the second wave. Is it showing up and spreading in places, and when you think of a correctional facility and certainly some of the conditions of the correctional facilities here, that makes it very much vulnerable and a risky place to have COVID-19. They do have a lot of measures in place, and it is important that those be strengthened and those be reviewed and strengthened. But there was a lot of measures in place that hopefully will limit any spread of the virus. But we do have to take a very strong approach to assess and act on to minimize the spread in those kinds of facilities.
In a few days, it's expected that the lockdown in Northern Ontario will be lifted, barring any changes. When we went into the lockdown, we were in the orange category. Do you have a sense of where we might go from here?
So I believe if we come out of the lockdown, which is supposed to be, I think, in the next couple of days, really, if that happens, we would go back to orange. That's where we went into it from, and I have no reason to believe that will be changed. I think, though, with what's happening across the province in the rising rates, as I said, where we seem to be the exception, not the rule, I think there's a lot of significant conversations happening at the provincial level right now about the state of COVID-19 across the province. And of course, we were treated a bit differently as a northern health units with the lockdown and being limited to 2 weeks. But, I'm not even sure if if the lockdown will be ended for us in the next couple of days. I don't know what the decision the government will be making.
Would you like to see it extended?
I think there would be value in extending the lockdown at least for another 2 weeks. I'm supportive of it. The return to school, which is despite that, but I'm very nervous, I think, about how things could go, what I'm seeing across the province, the kind of situations and the spread of this virus. This virus is strong right now. And while we've been able to keep it at bay in our area and really hold it a bit in check across the province, it's still winning this game right now. And that's the reason why there was a lockdown and put in place a couple of weeks ago across the province. And I think we can't let this virus get ahead of us. And the measures need to be put in place before the rates start to go up for them to be really effective. So I would be supportive of an additional 2 weeks, same with the rest of the province, because they're continuing on for another 2 weeks. I would be supportive, although not, still allowing that back to in-person school. I know that's a lot, and that might not be what people want, but we still have a ways to go through this second wave, and this is not the time to get COVID or to see it spread in our families and our communities.
Dr. DeMille, I really appreciate your time this morning. Thank you for joining us.
Thank you very much. Dr.
Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.